How is classic Hodgkin lymphoma different from other types? When we talk about classic Hodgkin lymphoma, we need to understand what makes it stand out from other types of lymphoma. One key feature is the presence of unique cancer cells known as Reed-Sternberg cells. These are large, abnormal B lymphocytes that can be seen under a microscope. This characteristic is what sets classic Hodgkin lymphoma apart from non-Hodgkin lymphomas, which do not have these specific cells. Classic Hodgkin lymphoma is the most common form of Hodgkin lymphoma, accounting for the majority of cases. There are two main types of Hodgkin lymphoma: classic Hodgkin lymphoma and nodular lymphocyte-predominant Hodgkin lymphoma. The latter is much rarer and tends to develop more slowly than classic Hodgkin lymphoma. Within classic Hodgkin lymphoma, there are four subtypes based on how the affected lymph nodes look and the types of cells present. The first subtype is nodular sclerosis classical Hodgkin lymphoma. This is the most common subtype, especially in young adults. It is often diagnosed at an early stage and is characterized by the presence of scar tissue forming nodules in lymph nodes, particularly in the chest area. Patients may experience systemic symptoms like fever, night sweats, and weight loss. The second subtype is mixed cellularity classical Hodgkin lymphoma. This subtype is more common in older adults and involves a mix of Reed-Sternberg cells along with other immune cells in the lymph nodes. It often affects multiple lymph node groups at the time of diagnosis. The third subtype is lymphocyte-rich classical Hodgkin lymphoma. This is a rare subtype that has many normal lymphocytes and only a few Reed-Sternberg cells. Lastly, we have lymphocyte-depleted classical Hodgkin lymphoma, which is very rare and characterized by fewer lymphocytes and more fibrous tissue. This subtype is often seen in advanced stages of the disease. Now, let's compare classic Hodgkin lymphoma to nodular lymphocyte-predominant Hodgkin lymphoma. In nodular lymphocyte-predominant Hodgkin lymphoma, the Reed-Sternberg cells are different and are called popcorn cells. This type usually progresses more slowly and requires different treatment approaches compared to classic Hodgkin lymphoma. When we look at non-Hodgkin lymphoma, classic Hodgkin lymphoma tends to start in lymph nodes located in the upper body, such as the neck, chest, and armpits. It progresses in a more predictable pattern, which can make it easier to diagnose and treat. Non-Hodgkin lymphoma can arise in lymph nodes anywhere in the body and involves a wider variety of lymphocyte types without the presence of Reed-Sternberg cells. In summary, classic Hodgkin lymphoma is defined by the presence of Reed-Sternberg cells, specific subtypes with unique features, and a typical pattern of lymph node involvement. These aspects clearly differentiate it from other types of Hodgkin lymphoma and the diverse group of non-Hodgkin lymphomas. Treatment and prognosis can vary, but classic Hodgkin lymphoma often responds well to chemotherapy, radiation, and immunotherapy. Always consult healthcare professionals for personalized medical advice.